Well, welcome back in on this Wellness Wednesday. We are talking about some types of cancer you may not think about often. April is Head and Neck Cancer Awareness Month, and here to talk to us about that today are Dr. Mohamad Issa and Dr. Andrew Rosko, both head and neck surgeons for ProMedica. Welcome. Thanks for being here today. I learned a lot about this in the few minutes that I was able to chat with you before we came on. So, but for people out there at home, they may say, well, I've heard of brain cancer, a lot of other types of cancer, but what exactly is head and neck cancer?
Well, we want to thank you guys for giving us the opportunity to, talk about this important topic and share this information with our friends and our colleagues and our neighbors. Like, this is near and dear to both of us, and thank you for that.
Absolutely.
Head and neck cancer encompasses it's a wide variety of entities. You have your typical head and neck cancer that you think about, your smokers and drinkers. That's cancers that start in your mouth that can go all the way down to the voice box and to the start of the food pipe. You also have skin cancers. We think about squamous cell carcinomas, basal cell carcinomas, and more rarely melanomas and thyroids.
Correct, yeah. Yeah, so it affects this whole area here. And you mentioned smoking and drinking. This could be caused by things like that, but also I'm learning HPV is a big one too.
Yeah, that's correct. So historically, head and neck cancer was primarily caused by smoking and drinking. At least those were the biggest risk factors. Smoking by far is the biggest risk factor, but that does work synergistically with alcohol use. But more recently, we've seen a big rise in HPV-related cancers. Those typically occur further in the back of the throat, in the tonsil area, or in the back of the tongue. It's actually the most common HPV-related cancer is now throat cancer, so much more than cervical cancer or other cancer types.
Wow.
Yeah.
So ladies, when you go and you get that yearly screening, okay, but it could affect you in other parts of the body.
Absolutely.
Wow.
Yeah, much more common actually now than cervical cancer.
Yeah.
Even.
So when we think about ways that we can prevent head and neck cancers, smoking, drinking, but getting vaccinated as well?
Huge.
Yeah.
And ideally you'd be vaccinated in your teens, but you can be vaccinated up to 45. Okay. And this is a preventable cancer, all right? And this is a cancer that, we're seeing now in younger and younger patients, and the vaccine is something that would avoid this whole issue, period.
Mm-hmm.
And really important too, not just for women, but for men. So when Gardasil, the vaccine for HPV first came out, that was primarily marketed towards women. But men, just like women, can get the oropharynx HPV-related cancer. So really important for both genders.
So now maybe you find out, okay, you have it. You have a cancer that you need treated. How do you go about treating these types of cancers?
Depends on the location, right? And so your typical head and neck cancers we talk about, so smoking and drinking, a lot of that is surgery with chemoradiation. Specifically, the HPV is a very interesting cancer subset. We're seeing this in younger patients who do very well, and the outcomes with respect to treating these cancers with chemoradiation is excellent. And so how do we treat these patients without over-treating them and giving them morbidity? And so that's where robotic surgery comes into place, and it's actually a very hot topic within the field of head and neck, and something that we're doing as well to make sure that the city has that care as well.
Yeah, this is being offered here in our area. Before, maybe a few years ago, folks would have to travel up to maybe Ann Arbor, out to Cleveland, things like that to be treated for this. But we were also chatting a little bit about that recovery too, and that reconstruction, because many times these surgeries require, you're removing parts of your jaw and right, so you're able to put people back together.
Absolutely, and that's the big thing. That's what really, where my heart is really with head and neck cancer treatment, because not just treating the cancer is important, but returning people to their form and function. If we think about what do you do when you we just finished Easter. So on Easter Sunday, what do? You get together with family, you talk, you eat, you have conversations. When you go out in public, the way you appear is really important in terms of stigma, et cetera. And so the reconstruction is so important in returning people back to their function, and that's really complicated reconstruction that we do, but to be able to do that in Toledo is just really rewarding, to keep that local care locally.
How are you doing this? You're taking pieces from other parts of the body, and it's really interesting.
It's called a free flap, and so you can trace different segments, whether it's a bone or whether it's fascia, skin, and trace it to an artery and vein, disconnect it from the donor site, and then reconnect it to an artery and vein in the neck, and then that tissue is living tissue for you to be able to utilize. Okay. And to Dr. Rosko's point, your face is how you interact with the world. It's how you see yourself, right? And so I think that's why me, him, and a lot of folks who do what we do this. It's to build a relationship and to figure out what it is that's important to that patient and get them back to their form of function and their life.
Yeah, give them back that sense of self.
Absolutely.
Again, they've gone through something life-threatening. Now they want to live that normal life again if they can. So you're helping to provide that, which is wonderful. Are there we talked about the risk factors, but are there some symptoms or things that people should look out for just in case they may be dealing with this?
Absolutely. So a number of symptoms. So hoarseness that doesn't go away. Pain in the mouth, pain in the throat, pain in the ear, believe it or not, that doesn't go away. So everybody gets a sore throat or an earache, but if that lasts for more than a couple weeks, that's something that would need to be evaluated. A neck mass, especially in an adult. So if you have a painless neck mass in the side of the face or in the neck, that's something that would need to be evaluated by head and neck surgeon or an otolaryngologist.
Yeah.
And if you have risk factors, as we talked about the smoking and drinking and high-risk sexual exposures, then any of those symptoms make you more worried and need to be evaluated even sooner than somebody who does not have those risk factors.
Yeah, so just important to keep up with seeing your doctor on a regular basis, and then they may refer to one of you. Yeah.
Absolutely, and advocacy is a really important thing, especially with a neck mass or some of these other symptoms. Really advocating, being aware that this is a possibility, because oftentimes these cancers are missed because some of the symptoms are so common in other conditions.
Sure.
So making sure that that referral is made early is really important.
Very good. All right, gentlemen, thank you so much for being here today. Appreciate it. We learned a lot about this, and as we said, it is Awareness Month, so just stay on top of it and know that there are fine folks here who are willing and eager and smart, and I'll put everybody back together. Thanks for being here today.
Thanks for having us.
Thank you so much.